Thank you, Mr. Chair, and very warm welcome to our guest speaker this morning. Jack Phelan has become a household name in the circles of child and youth care in South Africa and across the world. He hails from Edmonton, Alberta in Canada, but very fondly says that he's a New Yorker who followed his heart and married Marilyn, whom he met at the child care conference in Bland. Now, he's been coming to South Africa for a number of years now, not just as keynote speaker or a teacher or administrator or trainer or consultant or even supervisor, but he's actually become friends and family to many of us. He started his working as a child and youth care worker in 1967 and had lots of other responsibilities in the field of child and youth care over many years. He is a certified practitioner in New York and Alberta, and is also a member of the NACCW. He was instrumental in the establishment of the Child and Youth Care Professional Association in New York, on the East Coast of America, and then the National Association in the USA. And he served as president of the Alberta Child and Youth Care Association for a term. Over many years, Jack worked with teens, younger children, and their families. But he says he has always enjoyed being a child and youth care practitioner. Jack says that his travels around the world taught him many lessons, and he continues to learn at every opportunity he gets from people in the field. Some of the things that Jack says that has become favorite sayings that helped him become smarter over time, and I'm sure that some of us can relate to some of these ourselves. It goes as follows. He says, some of the things people say, we have tried everything with this kid. The kids get more difficult every year. And they don't pay me enough to put up with this stuff. And if we don't punish this kid now, they will think they can do it again. So I thought I will just remind and refresh some people who heard these sayings already. Today, we once again have an opportunity to engage with Jack as he presents on the topic, the use of self in the child and youth care practice. Please join me in welcoming Jack Phelan on this platform. Welcome again, Jack, and we hope to learn a lot from you today.
You say.
Hello everyone in South Africa. I'm up here in Canada. We're starting our spring, even though it still snows a bit sometimes up here. I'm very happy to be here. We're going to spend time today talking about something that might be a little bit complicated for people who are newer in the field, but I think for people who've been around a while, it should be a relatively familiar kind of topic. So what we're going to talk about today is how the worker changes as he or she becomes more experienced, and they shift how they see what they're doing in a very dramatic way after a couple of years of practice. So if you could switch to that first slide, please. Okay, so when you start working with young people and families, it's a very difficult process because you feel like you don't know what you're doing. You really worry about looking competent. You worry about doing a good job. So when you are a newer worker, you really talk about how things affect you. So I always say I can read the logbook in an agency or in a Isibindi report, and I can tell you whether someone's a newer worker or not, because they say things like, today was a good day, I didn't have any problems. Or things went well today, nobody got out of line, and it's all about how they got affected by what happened today. There's a point at which newer workers stop worrying about themselves as they become safer in the job. So that, excuse me, there's an example I like to use, that if you're working with a family or a young person and they start to give you a hard time, they refuse to do what you ask them to do, or they just ignore you, a newer worker immediately thinks about themselves. In other words, what am I going to do now? Uh-oh, I'm in trouble. Where after you become a bit more experienced, as people resist direction or kind of get annoyed at you, your first thought is, I wonder what's bothering them. So gradually, as you work with people and become more skilled and safer yourself, you stop worrying about yourself and you start to think about the other person. Um, when you have a couple of years experience, you can really get good at thinking about how other people think, not just how you think, so that you begin to view the things that are happening around you by how the other people experience them, not how you experience them. And then after about 5 years of practice, really fully developed workers can both think about themselves and think about the other person at the same time. So there's a book out years ago talking about it takes 10,000 hours to become really good at any profession. So that's in our practice, that's about 5 years of experience. And I want you to think about what we're going to do today is say your picture of who you are and what you're doing changes about every 2 years as you work well in the field and have good supervision. So you're really thinking more from yourself as if you want the standard of what should happen for about a year and a half, 2 years. And then you get better at really looking at things from the other person's point of view. And that takes about 2 years. And then gradually, after about 4 or 5 years, you can really manage to hold on to both what you're experiencing and what the other person's experiencing kind of simultaneously. So let's shift the slide there. Can we go to the next slide, please? Hello. Can we switch to the next slide?
Hi, Jack. I have
Hi.
switched to the next slide. There's just a delay in it.
Oh, okay.
So we are on slide 3 now.
Or yeah, we
There's
should be
just
on
a
slide
delay.
3. So what's important as you work with people is, what is your intention as you're working with them? Like, what am I trying to do? And so this is, as you start to do that, what you're doing actually changes pretty dramatically. So I'm still waiting for the slide to come up. So when you're a newer worker for your first year or two, you really are trying to become more attractive to the people that you're working with. You realize that that as you work with people, they have to want to talk to you. They have to want to be around you. Otherwise, you're not going to get much done. So even very new workers realize that I've got to be someone who the young person or the family kind of likes. Otherwise, they're not going to want to work with me. So you start to do things like, let me see if I can get interested in the music that they're interested in or the hobbies that they like, so that we can talk about something that they want to talk about. And you gradually try to be someone who is important to them, because you want to build a connection with them. And the most obvious way to build a connection is to be someone that they're interested in talking with. What happens as you get good at that is you start to evaluate whether you're doing a good job by, do people like you? So workers often think about themselves in terms of, in the group of young people I'm working with, I mean, am I popular among the other workers? Do they think I'm the best worker or a good worker? When I work with families, are they happy to see me? Do they want me to come and visit them? Do they say, oh, we've missed you since the last time you were here? So that I gradually start to evaluate whether I'm doing a good job by how well liked I am. Um, it's a it's a very important thing to do because when you're new, that really is it's probably the best way to work with people. As you become a more experienced practitioner, that becomes less important. And you really see that it's not about whether they like me or not, but it's really up to me to start to see the world from how they see the world, not necessarily to have them like me. Um, and that understanding the values and beliefs of the young person and the families I work with is really my goal, not really having them think I'm okay or I'm wonderful. So let's switch to the next slide, please. So when you're a newer worker, you want to be valued by the young people and families. You want to be liked and welcomed. So there's an interesting um, experience that I had years ago. I have a friend who was running a family support agency in the United States, and he was trying to evaluate whether his agency was doing a good job in terms of were they creating healthy families. And so he created a grid of this is what success should look like when people are on their own after they leave our agency. And he evaluated the families that they had been working with for the last year or two in terms of 3 months after they left, were they able to do this, that, and the other thing. And then he asked his workers, his family support workers, to evaluate whether they thought families were successful. What he found was that when he disagreed with the worker, in other words, they thought a family was successful and they didn't fit into what he thought success was, or when he thought they were successful and the worker didn't think they were successful, that the difference was families that the worker thought was successful but really weren't doing that well. When he asked them about the worker, he went out and visited them to evaluate how they were doing. They would say, "Oh, we really missed that worker. We really loved our worker. He was wonderful. We wish he could still work with him." And so what was happening is the worker was evaluating whether he was liked in terms of whether he did a good job, rather than was the family doing well. And when the workers who disagreed with him about successful families the opposite way, in other words, they thought they weren't successful and this evaluator thought they were, the families would say, "Well, we had a worker, but we did all the work. I mean, they were okay, but it was no big deal. We mostly did it ourselves." So that they didn't particularly need the worker or like the worker a whole lot, but they got a lot out of the program. So he said that workers that he thought really needed to shift their perspective were the workers that were evaluating their success by whether the families like them, as opposed to were the families doing well. And so that's a problem that newer workers struggle with, because their intentions are to be liked because they need to create that connection, but they start to see whether they're liked as whether they're doing a good job or not, and that not isn't necessarily true. So when workers, especially newer workers, talk about um, being missed, and they're really happy when they come back, that everybody says, "Oh, gee, where were you? We missed you. Don't go away for so long," as they're doing a great job. And in some ways, they're doing okay, but they need to kind of get a perspective of that's not enough. A lot of workers, when they're in the field for a year or two, which is, again, still struggling with this being liked, they get very frustrated when young people leave the program or when they stop working with families, because they feel a real sense of loss, that they wish they could continue to work with them. And that whole idea of separating from young people or families is very difficult for them, because they see themselves as wanting to be needed. And that it really is not that useful to kind of think that way. The other thing that happens when you use yourself as an indicator of success is you really see that role modeling is a useful thing to do. And again, there's nothing wrong with role modeling, but it should not be your goal, because think about it this: most of the people we work with, they like us, but they don't think we would be very successful in their world. They think we're nice people, but we have a whole different reality than they do. And if they really were to act like us in their own lives, it wouldn't be successful. So role modeling is one of those, excuse me, one of those strategies that seems like a good idea because you're teaching them some useful behaviors, but it fairly easily falls into, I want you to have the same values as I do. I want you to do things the way I do things. I have an interesting experience with my wife, who I've been married to for 40 years, and was a child and youth care worker. That I keep trying to tell her how she should change to be more like me. And she doesn't agree with me. In fact, she thinks I should be more like her. So role modeling doesn't work with someone that I love and I've been with for 40 years. So why would it work with someone who I've only known for a couple of months? They don't really want to be like me. Okay, let's go to the next slide, please. So when you're supervising newer workers, some ideas for supervision: you should encourage newer workers to build attractiveness with the young people and families they work with, because that's how you start to create a connection with people. So I'm certainly not suggesting that workers shouldn't try to be attractive to young people and families. In fact, even highly skilled workers start off trying to be very attractive to both the families and young people they work with, because that is the way to start to create a connection with people. So as you supervise newer workers, again, workers in their first year or so, you should support them to share interests in music, activity, hobbies that are appealing to the young person or family, so that they are someone that's valued by the young person or family. Being liked by the people you're working with makes it easier to build safety, trust, and connection. So again, a useful skill, but again, something that will shift as you'll see, as workers continue to become more experienced and skillful. So as workers are around for a year and a half, 2 years, they need to shift the focus from being a role model to really being able to see life from the perspective of the other person. So to stop thinking about, I want you to be like me, and to start thinking about, I want you to be like you want to be. So what I try to say in a fairly simple way is I want workers after about a year to start to think like, I don't want you to like me, I want you to like yourself. So my goal is not to get the family, the parents of the family, or the young person to want to be more like me. I want them to like themselves more and to value their own perspective more, which is a very different kind of intention than getting them to like me. Okay, let's go to the next slide. So when you're supervising people and you're trying to get them after a year and a half or so to shift from this perspective of being attractive to the people you're working with and being a role model, to now going into like doing this other intention where you want your workers to start to think like the clients, the people they're working with, the young people. The problem is that most workers are now feeling very comfortable with getting people to like them. They're good at it. And they value themselves as a good worker by how many people think they're likable. So now you're telling them, don't do that anymore. Well, they value being liked. Why would they stop doing that? The other problem we have with supervisors is many supervisors have only had that experience of being attractive to the young people and families they work with as their experience. So they, as a supervisor, value being liked by their workers. So when both the worker is stuck in this, I just want people to like me, and that means I'm doing a good job, and the supervisor is also thinking the same way, that both the worker and the supervisor can get stuck there. And I often see people who've been in the field for several years and supervisors who they think that's all they need to do. That's as far as they've gotten in their development. And they believe they're doing a very good job because they are appreciated by other people. And what I want to suggest to you and what we're talking about today is you have to go past that to do a good job as a child and youth care worker who's going to be relational, who's going to help people to change their lives. You've got to go further than that. You've got to shift your perspective to a different level of practice. And so let's talk about what that next level is. Okay, let's switch the slide. So we're talking about now going into what I call level 2 practice. So some of you may be familiar with the work I've done on the developmental stages of workers, going from a capable caregiver to now going to a treatment planner and change agent, which is that level 2 person. And what happens is that when you've been working in the field for a year and a half, 2 years, you start to realize that a lot of my good results only happen when the person's in the program or when I'm with them. That in fact, when I'm gone, either because they're out of the program or because I'm just, in between visits even, they go back to the way they were. So I always say, for example, in residential care programs like a group home, you have a young person come in who's doing drugs, who's not going to school, who's being aggressive with other people. And you put them in this environment, this group home environment, where there's lots of external control. And within a week, the young person's going to school every day. They're not using drugs and they're being nice to other people. They're not beating other people up. And we keep them in the program for several months. And they get very good at doing what we want them to do because we use a lot of external control. And then we send them home. And they're home about 2 weeks and they're not going to school. They're doing drugs and they're being aggressive again. And we end up blaming their communities. We blame their parents. We blame their groups, their kids they're hanging out with, rather than saying to ourselves, we didn't help that young person at all. We just forced them to do it our way for a while. And they had to do it our way because we had all this control, but we didn't really help them create any change in their life. So as that worker starts to realize that and starts to think like that, they realize, like, I have to do something different. That's not a good strategy, what we've been doing in terms of using a lot of external control. So now I've got to say, how do I get people to want to go to school? How do I get people to want to not use drugs? How do I get people to want to be nice to other people? And I realized that in many ways, as a more mature worker, a lot of my intentions need to change. That my intention to get you to be more like me really doesn't work. I mean, you'd be more like me as long as you're in the program because it's useful. But as soon as you're on your own, you don't want to be like me. You want to be like the way you've been all your life. So I realized that something has to change. So in our field, there's a group in Scotland at the University of Strathclyde that have created a really interesting bunch of readings about threshold concepts. And a threshold concept is in most professions have threshold concepts. A threshold concept is a radical new way of thinking that changes your whole perspective. So what happens for workers after a year and a half, 2 years who get very good at doing this job is they have this threshold concept experience where they have to really think about things quite differently. And so what happens for workers who are in this process after a year and a half, 2 years is they realize that my focus, which has been on basically on myself, like I want you to have my values, I want you to do it the way I think is a good way for you to do it, I want you to like me. I have to stop doing that. It's not that helpful. That the young person or family I'm working with, they're the focus. I have to get good at understanding the way they see the world instead of trying to get them to see the world my way. And that the third one, which is a hard one for a lot of people, is being needed by people is not really the goal. That's not really that important. That if they don't even remember my name after I work with them for a year, that's okay as long as they're being successful. So let's switch the slide. So the problem with threshold concepts is they're troubling and transformative. In other words, they really shake us up and make us question what we're doing and why we're doing it. So for that worker, they're losing their own personal perspective. They no longer see themselves as the standard for what's right and wrong. So my own personal values and beliefs about living well are now not that important because what I think is a good idea doesn't necessarily fit for you. And so you're going to politely listen or argue with me, but you're just not going to change because I'm doing it that way. Now, if you've been around in the field a long time, you realize that this is a very hard idea for a lot of workers. They truly believe that if you, young person or families, stopped doing what you're doing and did more of what I think you should do, you'd be more successful. And unfortunately, that doesn't work very well in the long run. What happens to skilled workers is they become very aware of the fact that the young person and family that they're working with have very different perspective on the world than they do. Now, that's fairly obvious early on when you work with young people and families who are always in difficulty. But the difference now is you're realizing that that's a legitimate way for them to think or believe. That I have to really work with their beliefs and logic about life, not try to change it into the way I want them to think about life. So one of the things I use in some of my examples is a young person you're working with comes home from school and you ask them if they went to school that day. Did they go to all their classes? And, they're like 13, 14, 15. And they say, oh, yeah, I did, Jack. I went to all my classes. So they know, then that the school's going to call in an hour with an attendance report. And the school calls in an hour and they say that this young person wasn't in school today. They were actually hanging out with their friends. So you confront the young person and you say, you weren't in school today. Why did you lie to me? And they look at you like you're crazy and get mad at you. And you just get very distressed that I thought this young person respected me and they obviously told me such a bald-faced lie. They knew the school was going to call. So I'm using my own logic and my own perspective to evaluate what happened. Think about it this way. Most of the young people we work with are very self-protective. They're very vigilant about not getting hurt by other people. So to them, it would be wrong to admit to something before the other person actually had the proof that they did it, because you'd be getting into trouble for no good reason. Now, that's not the way I think, but that's the way they think. And I have to get good at understanding that it's not a good idea to ask someone, did they go to school today, before I know for sure whether they went to school or not. Because when I can say, I know you didn't go to school today, the other person accepts it. Okay, I got caught. But when you ask them to voluntarily admit they didn't go to school, they think that you're just trying to get them into trouble. So again, I want you to think about that example a little bit, that newer workers struggle with that. They say, well, that young person's lying. And I say, that's not a lie to the young person. It would be foolish to tell you that I didn't go to school today. It would actually be wrong for me to tell you that. Now, that's difficult for new workers, but more experienced workers understand that. They say, yeah, that's a dumb question to ask a young person. So let's go to the next slide. So the problem for workers who are shifting from having this personal perspective to being more tuned into how others think, it's a very troubling idea. So the first thing you think about is, well, how can I help people if I can't use my own values? What do I have to offer if I don't have to offer what I think is a good idea? So that really kind of knocks me for a loop, because my way of living is the correct way to do it. I know that because it's worked for me. And it's a very interesting problem, because you have to become what I call very humble. You have to realize that what works for you is just useful for you. It's not necessarily useful for anybody else. So as you think about these troubling shifts, you think, well, the life logic of these young people and families, it needs to change. They're always getting into trouble because they believe that it's okay to steal, it's okay to lie, it's okay to beat people up, it's okay to not care about the future. And that is true, but they're not going to change because you want them to think like you. The last one that's difficult for people making the shift, again, and this is typically a year and a half, 2 years, is I thought I was a useful role model. I've been doing this role model thing. Now I realize it was kind of a dumb thing to do. And it wasn't a dumb thing to do when that was the best you had to offer. But now that you're smarter, you don't need to do that anymore. But it's hard to let go of that. I mean, I've gotten very good at being a role model. Why would I want to stop, And you say, well, because it doesn't work. So let's take a look at the next slide, if you would. So here's the issue for people. We talk about empathy in our business. We talk about really having empathy for other people. So what happens for the worker who's using themselves as a standard for what's good and bad? Their empathy when something happens to another person is to say, how would I feel if that happened to me? Or how would I respond in that situation? Which is not really that useful because it didn't happen to you and they're not you. But that's really the way that newer workers think about what's going on for that young person or what's going on for that family. So let me give you another example from a family perspective that would really have you kind of shift how you think about what's going on in terms of the empathy kind of situation. So you have a young mother in mid-20s who's got 2 young children, 3 years old and less than a year old. And you get a call that to come to the house because the neighbor has complained that the mother has gone to the bar down the street and left these two young children alone in their house. So when you get there and talk to the mom, she says, I don't know. I mean, I was getting really frustrated, and that's all I could think of doing was getting out of there and going and having a drink. And when we use our own logic, our own empathy, like how would I have reacted? You would not do that. You wouldn't just abandon, your children to take care of yourself, that kind of thing. Just good parents don't do that. But I want you to shift now to thinking like the other person. So now you have this young mother who's got these two young children that she really loves, and she wants to be a good mother. And as the evenings going on, the young children, as they do sometimes, start to fuss and need her attention, right? They want her to do something, take care of them. And as she gets that message and she's tired and it's a bit more irritating, what happens for her is she kind of subconsciously thinks back to the fact that no one cared for her when she needed nurturing. And she gets very angry. Now, she's not angry at her children. She's angry at her own life. She's angry at the people that should have been a good mother to her. But she doesn't think about it that way. She just knows she's getting quite mad. And so this young mother chooses to neglect her children rather than to abuse her children, because she knows if she keeps thinking about this, if this keeps happening, she's going to take a swat at them. So she leaves the house to go take care of herself, to feel better. So she's really chosen a good choice to not abuse her children, but rather just neglect them. Well, that's a very hard way to think as a worker. It's much more obvious to think about what does a good mother do? What does a bad mother do? And as we get good at thinking like the young woman who's, struggling, we can help her in a much more effective way than if we try to get her to be a good mother because she's being a bad mother. So again, having that accurate empathy, having to see the world as other people see it, is a real skill that takes time to get good at. So now my decisions and attitudes about what I'm doing and why I'm doing it are based on someone else's beliefs and logic. Now my response is quite changed from judging things by how I would do it to really evaluating other people's beliefs and logic about life and their own experience with their life, and seeing the strengths and the value in what they're doing. So what's happening for that worker after a couple of years, they start to see people in a much more respectful way. They start to see the kind of the good and beauty in people that up till now, everything's been a problem. So one of the things I try to tell workers, especially after a year of 2 years experience, because new workers can't think this way yet. They still are struggling with lots of more preliminary ideas. But that I always say to more skilled workers, this young person or this family has managed to survive up till this point in their life through some pretty horrible things that have happened. And it's taken them a lot of strength and skill and perseverance and life strategies to survive. So what I want you to get good at is seeing the skills and strengths and life strategies of that person, and not see what they're doing as problematic, because it has worked for them so far to be that way. Now, we also want to help them use those skills and strengths to improve their logic about life and their beliefs about themselves. But we need to use the skills and strengths they have, not the skills and strengths we want them to have, not the skills and strengths that I have, that kind of thing. So this whole idea of empathy is a big, big thing that it takes a lot of hard work to shift your view of things to be more, if you want, young person focused or family focused and less me focused. So let's switch the slide then. So when you're supervising people, when you're trying to help people make that shift, which is a very hard shift, first of all, you as the supervisor have to understand that shift. So if you've never done it yourself, if you've always just done I want you to be like me, you're going to have a very hard time with this. So you have to kind of get good at it as a supervisor. So you want to take this person who's been a successful child and youth care worker, who up till now, you've been telling them they're doing a good job. And now you want them to think differently about what they're doing. That's not going to be easy for them. So you want to help them stop using their own personal values and their need to be liked as the fundamental way to practice. So one of the things you need to do is expand the perspective of that worker, to have them look at, is that really that helpful? Like how much does working with young people and families that way carry over into their lives after they're gone? Are they really more successful by taking on kind of what we want them to do as opposed to doing what they think they need to do? So the whole idea of looking at long-term results as opposed to the immediate effect of helping people change. So I can get you to go to school 5 days a week, no problem, as long as I'm standing over you. But will you continue to do that after I leave? It's an interesting problem. So for supervisors, they need to help workers question themselves, challenge themselves, and to allow the worker to, if you want, not be the way they've been up till now. Now, some workers will think that's a great idea. Other workers will think you're crazy as a supervisor. Like, why do you want me to do that? Look, everybody's behaving well. What's the problem? We've had lots of people evaluating child and youth care supervision and worker satisfaction, and people leave the job. One of the things that I've seen over many years of looking at this is we often get really good workers after a year or two of being in the field, leave the field to become a social worker, a teacher, whatever. And their reason for leaving is, I've done child and youth care, I was good at it, now I'm going to do something else. And what I think has happened is they've only gotten good at being liked by people and using their own values, and no one's ever challenged them to go further than that. And so they think that that's all you need to do to be a good child and youth care worker. And the other reason I find people leave the field is because their supervisor has not helped them to continue to learn. They talk about poor supervision. And these are the people that know they need to shift, but no one's helping them shift. And so I think that we lose a lot of good people because we either don't support them to make those shifts or really create the need for them to make that shift. So a very crucial kind of issue for supervision. Okay, let's go to the next slide. So here's some of the problems for workers who are becoming more skilled at thinking like the families and young people and trying to not be too controlling. That most programs, whether it's an Issy Bindi program or a group home program or a family support program, they typically value external control and safety. Is everybody behaving the way we want them to behave? Are they doing it the way we expect them to do it? These more experienced workers realize that what we need to do is give people more opportunities to have self-control and not try to control them. That we want them to take over control of their own lives. Now, here's the problem with when you do that. When I let someone have more control over their lives, if they're comfortable with me and the program, the first thing they're going to do is to say, well, no, it works fine to have you tell me what to do. And when we say, well, I'm not going to do that anymore, the first thing they do is act badly, so we'll take control again. So what we have to do is give them some room to act badly, have the patience to let them stop doing that and start assuming more control for themselves. So you have to be able to let things get a little bit out of control in order to have people take control for themselves. And that can be very hard for supervisors who are watching this to have happen. I can give you again an example of when I worked in a group home. We realized that we had a lot of kids who they were going to school just fine when they were in our program, and as soon as they left, they stopped going to school. And we would ask them, we'd follow up with them and say, how come you're not going to school? They say, well, my mother doesn't wake me up. You guys used to wake me up and get me going, and you know, nobody's making me do stuff, you know. And we realized that we weren't really creating the kind of skills these young people needed to go to school on their own. So what we did is we bought them all alarm clocks, thinking that they would be able to get up on their own. We wouldn't have to do that anymore. Well, it was a kind of a foolish idea. If it was that simple to create self-control, we wouldn't need to be working with them at all. So the alarm clocks all got broken or lost in a couple of days. And what we did, we decided to do it differently. And it took some months of thinking about this, but we came up with a plan. So when we thought a young person was becoming more mature, more willing to take self-control, I would sit down with them on a Wednesday. And again, Wednesday was important. And I would say to them, we have been talking about you and think that you're really becoming more mature. And so we want to give you an opportunity to get yourself up in the morning rather than have us wake you up. And so we're going to give you this alarm clock, and we want you to get yourself up in the morning. And the young person would say, well, no, I don't want to do that. Like you guys, I like it. You guys wake me up. I'm sure I get up, blah, blah, blah. And we said, well, no, we're going to start with this alarm clock. And you have to get up by yourself and get to school on time. And we said, well, here's the thing, though. If you don't get up on time, in other words, if it doesn't work for you to use the alarm clock, you won't get into trouble. We want you to do it on your own, but we don't want you to get in trouble. So if you get late, if you're late for school tomorrow or don't get up on time, we'll write you an excuse. You won't be in trouble. Okay, so I'm going to get this alarm clock, but if I don't get up, you're going to write me a note. Okay, good, I can do that. So that night at dinner, this kid would announce to all the other kids, I don't have to go to school tomorrow. Jack said, I don't have to go to school. And they would be like, how come? He said, well, I got this alarm clock, and now I don't get up if I don't want to. No, they all said, well, give me an alarm clock. I want to do that too. And I would say, no, that's not what's going on. We think that this young person is mature enough to get themselves up, so we're giving them an alarm clock. And what would happen is they would or they wouldn't get up. and whatever happened. But typically they would get up, and we would say to them, you know, here's the other part. If you can get up on your own successfully, regularly, you can set your own bedtime. And that was a good benefit. So we always did it on a Wednesday because they only had to get up twice, just on Thursday and Friday before the weekend, where if we did it on a Sunday, they'd have to get up 5 days in a row, which would be much harder. So we would really congratulate them and support them, and then they would gradually, you know, use the alarm clock to get up, and then they could set their own bedtime. And for young people, and these were all teenagers, right? So for young people that could do this well, we found an interesting thing too. They often went to bed earlier than the other young people because they were tired. So they didn't stay up till what we thought was a bedtime for everybody. They basically regulated themselves. So sometimes they stayed up later, sometimes they went earlier. And we laughed because we said we've created this situation where kids, even though they're tired, will stay up because it's not bedtime. And so that whole idea of assuming more self-control becomes really, really very interesting. You know, you realize so much of what we do is regulating other people based on what we think is a good idea rather than letting them do it themselves. Now, the problem with these kinds of situations is less experienced staff criticize this approach. They say you're favoring this kid over the other kids. They say you're making my job harder because I just enforce the rules because that's the best I can do. And we have to get good as supervisors and as coworkers at allowing the different staff members based on their skill and experience to do different things, to run the program differently. The other problem for workers who are now at this skill level is supervisors can be a problem. They can kind of demand that you follow the rules and make sure those kids go to school, and you know they don't want any problems from the school calling and all this. And that's where that more experienced practitioner gets frustrated and leaves because the supervision is not what they need. Here's what I want you to think about. Handing back control and power over their own lives is a very useful thing to do. It creates good results. So we need to do it more often instead of worrying about how annoying it is as an adult in my life to do it with these people. And it's a very interesting shift for workers who now have this new perspective of seeing things from the young person's perspective or from the family's perspective, is they realize that most of the people they work with, the other staff and their supervisor, won't like it when they start to do that. And they have to kind of get resistance from the young person and family and get resistance from the people they're working with at the same time. So a lot of workers just give up and say, screw it, you know, I'm just going to do my job. It's easier to not argue with people, even though they know it would be better to do it a different way. So that's a real challenge for creating these new perspectives. Okay, let's go to the next slide. So when you're a level 2 worker, when you get good at having this new approach, one of the things you realize is young people and families really respond well to you now. They really have changed the way they're working with you. They literally want to be more cooperative rather than just doing things because you've got the control. They basically ask you to help them figure things out. Now that takes time. I mean, so what I have found as a supervisor and as a skilled worker, that after about 3 years, 4 years of practice, you're significantly different in how you work with people, and they really respond differently to you. And as that happens, you're realizing that what I've done is I've started to see the other person's logic about life, and I have a lot more respect for them. I have a lot more willingness to see them living their life well based on how they see life. Now, I still want them to do some changing. Otherwise, I'm not doing my job. I still want them to become more hopeful. I still want them to become more confident about their ability to be different. I still want them to learn how to nurture themselves and other people. But I want to do it from where they're stuck, not from where I want them to be. So again, another metaphor, if you want, that I've used is the people we work with are stuck in a situation where they've been abused and neglected and possibly severely traumatized by life, and they're kind of isolated from the rest of us by those situations, so that they've acquired a lot of behaviors and beliefs about life that are really not very helpful. And so they're kind of stranded on a desert island. Um, they're kind of in a survival mode that they can't get out of. They can't think about tomorrow. All they think about is getting through the next 24 hours. So let's use that metaphor of being stranded on a desert island. So here's this person stranded on a desert island, or this family, and then there's this airplane flies by, this child and youth care airplane, and they wave, and the person in the airplane sees them, this child care worker, and he drops a note down on a little parachute, and they read the note, and the note says, "It's not good for you to be there. You shouldn't be there." And that's like a lot of our treatment plans. We say this person's got to stop doing what they're doing and be different, which is not that helpful. They know that they're on the island. They don't need you to tell them that they're stuck. So the second plane comes by, and it's another child and youth care worker, and he or she jumps out in a parachute, and they parachute down. They land on the island, and the stuck young person or family says, "Oh, good, I'm glad you're here. Like, you joined us. So let's get out of here. You got a map, you have a food, you have a raft to go anywhere." And the worker says, "Well, no, I'm here because I want to support you, and now we're all stuck because I didn't bring anything to help you. I just wanted to be liked by you and join you where, in your distress." And that's not very helpful either. Like, the third worker comes by, and he lands, and he's got a life raft, he's got a compass, he's got food, and says, "Let's start from where you're stuck and get you out of here. And we need to have these kinds of skills and instruments, if you want, to get you help." So we often, when we work with people, we don't accept where they are. We tell them you shouldn't be there, or we accept where they are and we just join them there in sympathy and say, "Gee, this is tough. Like, I'm glad I'm not you. You should be more like me." When what we really need to do is join them where they are with the skills and equipment to help them move forward. And so I can really appreciate being stuck on a desert island when I'm stuck on the desert island too. But I also need to have the equipment, the skills to get off the desert island. Otherwise, I'm wasting my time. So when I use my own values and beliefs to evaluate situations, it's not that helpful. I need to see things from the other person's perspective, because the skills and strengths that they're using to survive have been ignored by me because I'm too busy saying you should be like me. And as I start to see what skills and strengths they have, I start to really understand how to work with them better, because I need to work with their strengths and skills, not my strengths and skills. And what I want to suggest to you is suddenly you hear things differently. You can listen to a person in a whole different way. You start to hear what they're really saying. I often ask people just to, when they're struggling with a young person who's not being very cooperative, I say, just write down what they tell you for a month. And what they say is, you people aren't helping me. You people are all stupid. You people are all jerks. You people are making me crazy. And what they're really saying is, you're not listening to me. You don't even understand what's going on for me. And as you get better at joining people where they are, you really can hear things much differently. The nice thing about all of this shift in perspective is you start to enjoy your job more because you actually are creating useful results. Your intentions now are not to be a wonderful, well-liked person, but to really help other people become better at living their lives. And that has much more satisfaction than trying to force people to do the things that you think are a good idea. So let's go to the last slide here. So how do you evaluate success when you're a level 2 worker, as opposed to, do people like me? Do they miss me? Do they think I'm wonderful? Are they acting more like me now? As a level 2 worker, you're evaluating success by, do they function well without me? Are they getting better at creating self-control rather than responding to my control? So when they can choose to do the things they need to do without me rewarding or punishing them, that's success. Has a sense of personal power increased? Do they like themselves more? Do they value their own strengths more? Are they becoming more hopeful? One of the things that I realized after a couple of years is the reason why most of the families and young people that I work with didn't work very hard at improving their lives is because they didn't believe anything would change. They had very little hope that their lives would ever get better. And that going to school or learning to do things better was not that good of an idea because nothing was going to change anyway. Why would I bother? It's kind of like if you thought the world was going to end next week, you wouldn't put any more money in the bank to save for the future. You wouldn't go to school anymore. What's the point? You probably would quit your job. And a lot of the people we work with, they really believe that there's nothing in the future to look forward to. And that whole idea that what we really need to do is help them increase their sense of hopefulness, as opposed to getting them to go to eat a meal well, or go to school, or read a parenting booklet, that shifts what we're trying to do. It shifts how we're trying to do it. Do they value themselves more? I don't want them to like me. I want them to like themselves. Just that intention of mine changes on many of the things I'm going to try to do with people. And then really, one of the things we really understand very well about working with the people we work with who've been abused, neglected, is that they have a hard time caring for others because they have a hard time caring for themselves. And that whole idea of being nurtured and nurturing other people is really a critical kind of a skill that they need to develop in order to continue to lead a good, successful life. So that whole idea of helping people learn how to care for themselves and care for other people is very, very important. So I'm going to stop, and I want people to ask questions or make comments. So I don't know who's organizing the questions, but let's do that.
Thank you very much, Jack, for sharing with us a very relevant and interesting topic. We had lots of people already making comments there in the chat box. So we would like to ask people to share their comments or to make some comments or questions in terms of what has been shared here by Jack. So if you can raise your hand, then I can see if there's questions. I also have noticed few people have already posted some questions there in the shift box, in the chat box, sorry. So I would like to, I saw Dr. Molepo Lesiba, you post a question there. Nisia, there's a Zodidi Zibongile. So if you could just raise your hand and that we could acknowledge you and then ask you to share your questions. Let me just quickly see. I see there's a, yeah, we would like then, Donald is want to open the gate in terms of comments or questions. I don't see any other hands yet. Donald, we'll hand over to you then.
Thank you very much, Jack. This was a great presentation, and I can see Jack in the woods there. Yeah, and listening to what you were saying, it feels like it's talking to many of us here. I always get moved by that the international challenges that people come across, like what you would come across in Europe when working with children. It's not different to the challenges that we're coming across with in Africa and South Africa in particular. And I've got one question and one comment. My first comment is that sometimes when we work with children, we can easily want them to be like us. It was very good to listen to you talking on that. It's important that we recognize that they are not us. They are unique. Their behavior is unique, and they cannot be like the next child in the group of children that we are working with. And we need to help them to grow and develop in that way to become the better person, the best person they can be as an individual. I mean, I find it very interesting when you touched on something that was linked to that. And my other point is a question around the emotional that in some professions they'll say, like, if you are in medicine, they say you don't get emotionally involved when you are working with clients. But our work is very much about emotions. And is there something like anything like not getting emotionally involved when you are working with the child? Because it's emotions that are at play here. Thank you.
So whether you should get emotionally involved, I think absolutely you should get emotionally involved. That one of the things we try to help young people and families do is learn how to care for people, learn how to care for themselves. And they have to feel like we care about them in order to experience being cared for and being basically worthy of being cared for, and then learning how to do that with others. So yes, absolutely, it's you have to get emotionally involved, and that's one of the struggles when you start to become that level 2 worker, is that it becomes hard not to get really challenged and depressed by how difficult it is for the people we work with to feel cared about. And so our emotions have to really be very obvious, but also we have to get very good at being positive and kind of hopeful as we work with people who struggle with hope.
I saw someone, Bongi, that also would like to thank you, Jack, that they have got a question. Bongi, if you can unmute.
All right, thank you very much, Elwin. Greetings to everyone. Thank you very much, Mr. Jack, about the very fruitful presentation. It's just a comment, actually, and a general question. The question is there any aftercare programs for our children? Because most of our children that are coming out of the system or from the residential care, when they go back to their communities, sometimes we experience them to go back to what they were removed from. You made an example about a child that may be using drugs, and then that child being put in the system, then he will be there maybe for the 3 or 6 months in a program. And after he finish that 6 months in the program, that child go back to the community again. Then you find out he goes back to the drugs again. Is there any systems that are being put in place, especially here in South Africa, that are able to help our children when they go back to their communities? If there's anyone that can assist me with that, like maybe in Cape Town, Eastern Cape, in Durban, as well, to acknowledge them, a program of ECBND program, because I think that is one of the programs that I am aware of it, but I don't hear so much about that program anymore. So can I just get a clarity of how or what can we do to be able to assist our children after they are being released from the residential or the secure facility programs? Thank you very much.
Okay, let me just quickly, one of the things, because I worked in residential care too and got very frustrated with lack of aftercare. We have to live with the fact that many places don't have good aftercare programs. So because of that, we have to get much better at helping young people before they leave our programs to make good choices on their own and not make good choices because we're controlling them. So what I think you need to think about as a residential program worker is we need to get better at having more self-control training rather than external control going on, because there may not be an aftercare program. There may be, and even when there is one, it's important for that young person to choose not to use drugs, to choose to go to the ECBND program, not just somebody's going to force them to do it.
Thank you, Jack, for coming back. I just gonna ask Zeni if you could perhaps just share some light on ECBND. There was a question from Bongi. She doesn't see our program anymore.
Yes. I think that just to say that the reality is that when the Department of Social Development took over the ECBND program, they transformed it now into a program called Rishia, and we have been hearing similar feedback that it is not visible in communities, the ECBND workers, like they used to be. Because if this were the case, then children in residential care and child and youth care workers in residential care settings should be able to refer children for aftercare services to the ECBND or community-based child and youth care workers. And even now with ECBND, Isikoleni, to refer children to be supported in schools. So that is a way in which childcare workers, if we are working and functioning effectively in different settings, we can complement the services to children and provide seamless service. But I think that Jack's point is very valuable. When we have the children and young people with us, we have to do the best we can to help them cope in environments where there might not be a childcare worker as well. I'm not too sure if that's helpful, Elwin.
Yeah. Thanks, Jenny. And then I just want to share with you, Jack, there's a comment here from Clarissa Jacobs. He says, thank you for the presentation, Jack. This kind of perspective to child and youth care really opens the door for us to work more strongly on building resilience in both young people and their networks of support. So that was that comment. And then there was a question here from Sibongile. Sibongile said it is very difficult to supervise a child and youth care worker who is not willing to take the available opportunities to develop themselves in any way, either professionally or personally. How do we enforce this to child and youth care workers? So Jack, I put a question there from Sibongile to you.
Yes. So here's a quick answer that I always found to be helpful. Like in any group of 6 workers, you're going to have 2 workers who are willing to change, 2 workers who will never change, and the 2 workers in the middle will go with whoever wins the battle. And you have to kind of realize that it's not that helpful to spend a lot of time and frustration on someone who's not willing to change. You just surround them with people who are willing to change, and basically gradually try to get them to do something else with their life rather than drive you crazy and work with kids in a bad way.
Okay, thank you.
Yeah. That's a very helpful response. I think Sibo's got a hand up, I think. You can speak, unmute, Sibo.
Hi, Zeni. Hi, everyone. Hi,
Hi,
Jack.
Sibo. Good to hear your
It's good to have
voice.
you again. Yeah. You know, I'm laughing because I'm frustrated. Sometimes you can be, you can laugh when you're frustrated, for different reasons. And you know, my addition to my question is that in most times we find the situation of having child and youth care workers who joined the profession by mistake and who are not finding time to transform themselves. And it goes a lot with, you know, the issue of the spirit of Ubuntu or humanity, because we work with people, we work with children, we work with human. Then if you can't change, and in most cases, we have people who found themselves in the profession because of being desperate, looking for a job, and they find it difficult to realize that maybe I wanted to be a teacher, but it did not happen, and now I'm finding myself here, of which it's a different profession, it's a different field, it's a different place that I ever dreamt of, that I will be here and doing this kind of job. And it is difficult for them to transform, even if you put the opportunities right under their nose, they cannot see. And you mentioned that some of our children are reluctant to develop themselves or to take the opportunities because in their minds they have the attitude of not seeing the change or in their lives. And it's not only the child and youth care workers, our very same child and youth care workers as well. They are in that situation, and yet we expect them to go out and engage or interact with the children who are at the same situation as they are. And once you have that kind of a child and youth care worker in your organization, now you get stuck with them, and you don't know what other mechanisms that you can use to develop this person. It's a very difficult situation, and you find that the person do have a theory, but it's not, sometimes it does not need the theory to do a good practice when you are a child in youth care worker, but it needs you as a person to have, to have a passion of developing yourself and being hungry for more, so that you'll be a best child and youth care worker. Because even if you have a certificate hanging somewhere in one of your walls, but the certificate won't do the work needs you as a person to transform yourself for the best interest of the child. I'm not sure how we can instill this attitude to the child and youth care workers to have a kind of mechanism where we put maybe a cement between the blocks, of which the blocks is the theory that you have. Then we come up with the idea of putting the cement between the blocks to build this child and youth care worker to be sensitive when it comes to engaging with children, and for the rights of children, for the needs of children, and to respect the beliefs and values of these children.
I think you answered your own question, but in some ways, as a supervisor, your job is to work with the staff, not with the children. So I would try to build hope in that worker the same way you want the worker to build hope in the children. That would be my goal with a worker who seems to feel at a dead end.
Yeah. Yes, thank you, Sibo, and Jack, thank you, Jack, for the short response. I thought Sibo was starting a lecture over again. Thank you, Sid. I see that we've got 4 hands here. I'm just gonna ask that you then pose your questions as I mention your names. We've got here Ndumi Konyana, and then we've got Nontobeko, and then we've got Slolele. I can't see the other name there. Is it Queen Nzwane? Yeah. And then we've got Dr. Lesiba. And then we've got the Jubilee also. There's 5 questions. Jack, you want them to all post their questions first, or must they do it one by, then
whatever you want. It doesn't make any difference.
Okay, now. You may post in your questions as such, and then Jack will respond as I've called your names. Thank you. Oh, now I only see 3 hands now. The others have disappeared.
Hello.
No, who's speaking now? I can't see.
Hello. Good afternoon. This is Lumiso Koyana speaking.
Okay.
My hello. Come again?
Yes, go ahead.
Okay. Good afternoon to everyone. Also wanting to say thank you to Mr. Jack for insightful presentation, which shared a lot of interesting things. While you were presenting, more especially, I've got fascinated by this shifting of perspective. I work in a level 4 center where I deal with children and youth who are in conflict with law. It's a level 4. We deal with them who are really in conflict with the law. Now, some of the things that you've mentioned, for instance, you'll be working in a moment, in a life space, you'll hear them. It's such things that you also mentioned that a typical example, a child will tell you, sir, you won't understand. You see, now my question would be are there any material available, where we could start implementing this this thing whereby it's no longer about myself now, the child or the youth following my dreams and vision, but allowing themselves, is there more material that we could work on? Because I'm coming from this angle. Is there a limit? Where do you jump in? For instance, okay, you allow a child, okay, start being in their own life, and you hear the aim. For instance, the child will tell you, I will never leave gangsterism. Okay, my father was a gangster, my mother was a gangster, blah, 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 blah. But also you as a child and youth care worker understanding that the past can never determine the future. Now, you are saying that at times now it will no longer be about myself, but about them, okay? Now, material, is there a particular material that we could work on, focusing on that? Because a child will tell you, once I get out of this center, okay, I serve my sentence, blah, 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 I'm going back to gangsterism, you see. And also, the issue is a comment on the people leaving the field. I heard you saying one reason of which I beg to differ there to that one. There could be many reasons why people leave the field. Maybe it's a discussion for another day. And also some of the things that we face as child and youth care workers in our particular work environment is that we are in a environment where we don't sing the same language. What do I mean by that? You find that there are people who have done the training, there are people who have not done the training, there are supervisors who are not trained, and there are child and youth care workers who've done the NQF level 4. Now there's that, people singing different things. Now, if I decide that I was attending this webinar, let me try this method that I've heard there, and then now if I'm on that role, and then a supervisor will come in, and start, throwing stones. Those are the kind of things you see that we as child and youth care workers also are facing, whereby in the work environment where we are the center of the facility, we're in this one basket, but we're different ingredients. We don't sing the same song. Yeah, thank you.
It's a lot of stuff, and you're right. Those are all the frustrations of working in our field.
Good day, colleagues. Good day, colleagues.
Good day. Good day.
Sorry, can I just ask, when you post your question, just be brief and short. Jack, I don't know if you would like to respond more, or is it?
There was too much there it's a lot of stuff, but it's not a good answer to most of that. Those are the problems we all face every day.
Yeah, okay. But yes, and I just want to also share that we will share the presentation with those that have logged in for you to, and then we could then also share and bring our other questions that we can then forward to Jack at a later stage. Yeah. Can we who's the next one that would like to speak now? Let me just, you might go ahead, ma'am. Is it non-tobacco?
Yes, I believe it was me, Erwin.
Yes, go ahead.
Afternoon, colleagues, and I just want to say thank you to Mr. Jack for the lovely presentation. It's quite thought-provoking, if I might say. And then my question is around the issue of supervision, having a thin line between supervision and snoopvising. How do you draw the line as from moving from supervision to snoopvising? Because a lot of the times, I would say some of the activities that you are required to do as part of supervising, I would say require accountability. So some of the ways to ensure accountability in that aspect draws closely to snoopvising. And how do you draw the line that it doesn't become snoopvising as opposed to supervising, because the minutes a child and youth care worker feels like they're being micromanaged is the minutes I believe as a leader you lose them in any sense of development.
It's a good question. I wrote a book on supervision where I talk about new supervisors micromanaged almost all the time, and it drives more experienced workers crazy. One of the things a supervisor should be aware of is that unless people feel safe with them, they're not going to have the kind of relationship that will be a learning relationship. And so when a person feels like you're trying to catch them doing something wrong, they're not going to be able to work with you in any kind of supervision that would be a learning kind of process. So supervisors need to, much like you would with a young person or family, they need to create a safe environment to interact. So yes, when your job is to catch people being lazy or bad, I mean, you're just not being a good supervisor.
Thank you. The next one, I think it's from my who's that? Dr. Lesiba. You could post your question. Thank you.
Thank you, Chair. Good afternoon, Jack. Good to hear from you. My question relates to the need to be liked. Does that also apply to the experienced worker, especially those workers who might have assumed supervisory roles in new programs? What are the chances of that need re-emerging in another format? Thanks.
Yeah, I think I talked about that a little bit in the presentation, that some workers who never got past thinking that being liked was the goal become supervisors. And as a supervisor, they have the same experience. If people like them, then they're being a good supervisor. And I think that people get stuck there, and they need to kind of realize that they have to go further than that. So as a supervisor, you need to kind of do things like listen to this kind of presentation and realize that you need to kind of shift your perspective, because you are limiting yourself and you're limiting your workers by having that perspective of being liked as the goal.
Thank you. And then I think this is the last question I've got here. I can't pronounce your name properly, but excuse me for that, but it's Miss Queen Nzwane, yeah. Thanks. You may speak.
Good day, colleagues. My name is Suluhello.
Thank you.
Yes, it's Suluhello. I would like to thank Mr. Jack for a very informative seminar. But then my problem is that I'm from an NGO funded by the SD drop-in centers. It's very difficult for us to do our work as child and youth care workers. It's like we're living in a bottle. These kind of seminars, we get this info, but we cannot put them into implementation, because now we are working as the way the managers want us to work. And then I was also gonna ask about supervising, but Nontobeko already asked. Thank you.
I'm not sure what the question is. So when you're in a situation where you can't do what you'd like to do, you have to develop strategies to work around some of the program specifications. But and it's hard to do that. Sometimes you have to look and say, maybe I'm in a job that's just going to drive me crazy.
I think that sometimes, Jack, if I could just come in here, child and youth care workers are so eager to learn and to implement what they've learned, like I think we're saying in this case. But when you go back to your program, your facility, you can't implement because you have managers that are holding you back, that won't hear you and won't allow you to shift and grow. And I think that was the question, that I think just expressing the frustration of that.
Yes. Yeah, I certainly heard that. I don't have any fast answer to how to do that. You really need to kind of encourage your supervisors to go out and do some development too.
I'm just wanting to know if I could just ask Chair a question here that Aviva has put out. She's from a children's home and she typed in a question that says how to give children the opportunity to behave badly and self-regulate when their behavior harms or negatively influences other vulnerable children. So she's from a childcare center, and I think when you made your point about giving them a chance to behave badly and self-regulate the influence on others.
I don't think it's not so much behave badly. I think it's very important for all of us to know that safety is a key, so that I would never deliberately let someone do something that's unsafe to them or to other people. So I'll often say to young people who say, well, why are you making me do that? I'd say, because I want you to be safe. Like it's not negotiable if something you want is unsafe.
Great, thanks.
Thanks. I don't see any other hands or people that would like to comment. Let me just share with you, Jack. There's some people already shared with us some vote of thanks. And then I'm going to also ask Zeni just to summarize maybe some of the comments she's picked up there in the chat box. But some people say they appreciate, love this shifting perspective, showing us a new approach. The topic is thought-provoking and mind-blowing. Thank you for sharing this knowledge and insight and the experience and empowering us to build resilience. So those people, some of them have left already, and they just left these kind of a few comments that I would like to have shared with you, Jack, at this stage. Zeni, is there anything that is, before we close, that you'd like to summarize for us?
Yes, someone said that I love this presentation, would like to see it applied within South African context. This topic is thought-provoking and mind-blowing. Once again, food for thought, sorry. I'm just looking at some of the other points here. It says that a good leader, as well, a comment is one who is able to build capacity, strength, and skill of the people behind them. And someone also made a lovely point that owning values, sometimes one's own values, is helpful, as these young people are from totally different backgrounds where there were no rules at all. I think that people are actually picking up from you and relating to what you're saying, Jack. So I think that you've hit the right spot with South African child and youth care workers on supervision, but I think also on their relationship and the relationships with children.
Thank you, Zeni, for giving us that summary. I've just been informed we did share with you participants. There's an evaluation form that we would like those that participated also to complete. And as I have said, we did share our first webinar was with, as you can all remember, was last year with Dr. Heather, last month, Dr. Heather Maudlin, and we did share with our regional chairpersons and organizations to utilize it in their staff development and training sessions. And also, if there are more questions, to send it to us as the NACCW. So at this note, it seems, Jack, that there's no other questions or comments coming forward. And at this point in time, we gonna call on then Vanessa Grootboom. She's the chairperson of the Eastern Cape to do the vote of thanks. Vanessa, if you could just also open your camera and then do the vote of thanks for us.
Good afternoon, NECCW family. Mr. Gann, I'm not able to open my camera. If the organizers can just allow me to open my camera. Thank you.
Okay, you may continue.
Good afternoon, everybody. Yes. Good afternoon, everybody, and thank you to NECCW team for allowing me to do the vote of thanks. And thank you for this space, the webinar that we can have every month. And thank you to Jack Phelan. Thank you so much for your training today in child and youth care practice. The methods that you have shared today was very relatable by using this real life experience on a daily basis, especially how we think of self, not thinking of ourselves all the time. And the level in level 2 in self-practice to understand how others see the world, how we only seeing the world. And also the methods of troubling and transformative ideas, losing personal perspective, and also awareness of being different in logic about the truth. And also shifting empathy. This was really something new for myself in childcare. That empathy is hard working, especially that we need to shift our minds and to use the methods and the children and how children are thinking and how families are thinking. And also to use the new perspectives, give people more opportunities to self-control than we control them, allow them to make their own decisions, and also to focus on their strengths and their beliefs. The training was enormous value and will definitely add value to us and sustain us more in our child and youth care practice. We are really thankful for this excellent training and appreciate it from the bottom of our hearts. And also thank you to all our participants who were with us during this session. Thank you so much.
Thank you very much, Vanessa, for the vote of thanks. I would now call on our Deputy Director, Dr. Zeni Tambadu, just to kind of enlighten us on future webinars that would perhaps follow. Zeni?
Yes, thank you. Thank you very much. I just want to just add to what Vanessa said, just to say that, as she said, Jack, we thank you from the bottom of our hearts. It was a special presentation that touched, I think, the hearts and minds and hands of the childcare workers sitting here today. And I think we really appreciate this opportunity to have your expertise, and of course appreciate that you got up so early to be here, to be well prepared. Just for everybody to know, it was 5 o'clock this morning that Jack was presenting, 5 o'clock in the morning, and he got up, and yesterday he was testing his sound out to see that it would all work well. So we really do appreciate, and we are so very grateful, because you're so special to us in the child and youth care field. For others, just to know that there were more than 100 people who attended this webinar, but we know that they were in groups watching around the country, so there are large numbers, and many others will take the the recording of the webinar and the PowerPoint presentation and take it forward in their programs, and we encourage people to do that. In the way forward, we've got 2 presentations. The next presentation in May was going to be Professor Jim Anglin, and he was going to speak about trauma and pain and healing in child and youth care work. Unfortunately, the date doesn't work for him, so he's rescheduled for June. So next month in May, we're going to have James Friedman coming on board with his topic, Leading with Kindness in Child and Youth Care. Now, May is Child and Youth Care Worker Week, and so we are going to be celebrating, and it's a wonderful theme for our Child and Youth Care Worker Week. So we look forward to that presentation, and we look forward for everybody coming together. I think that there were a chairperson, if I can just say, some very strong comments that were coming through when people were communicating, that we want to practice what we've learned. We want to make childcare workers feel more powerful. We want their voices to heard. We want them to be happy in their work environments. And I think that we must make sure that Child and Youth Care Worker Week, in a very strong advocacy effort, puts out this message to all who need to hear, government officials, as well as other significant stakeholders, to understand that child and youth care workers need good working environments, good working conditions, decent salaries and opportunities to grow. And I think that the power in our voices will come, Jack, from some of the guidance you've given us in your presentation. Just to say thank you. Thank you very much from me. Thank you.
Thank you, Zeni. I see Donald, there's a hand. Maybe it's an announcement. Donald?
Yes, thank you very much, Chairperson. It is an announcement. Of course, thank you very much, Jack, and everyone here. Zeni spoke about the Child and Youth Care Week that's coming up from the that first week of May. The Professional Board for Child and Youth Care is planning a summit on the 2nd to kick off the Child and Youth Care Week. You please be on the lookout. You will see the invitations. Please do attend. We are hoping to have the Minister of Social Development, the universities, and all the people who made promises in the past summits. They will be coming to give feedback of how far they have gone with the development of the child and youth care work. So please do join us. It is important that we show in big numbers, because that shows how serious we are as child and youth care workers in this profession. Thank you.
Thank you very much, Donald, for the announcement about Child and Youth Care Week. Jack, there I also appear next to you. On a lighter note, I've learned today, Jack, you've reminded me I mustn't expect you to be like me. And you know, I was a good gallant. So thank you very much, Jack, for sharing. And then before we close, we would like to give you opportunity, maybe just to summarize or some other thoughts that you'd like to share before we close.
Again, I just want to thank you for the opportunity. I love connecting with people in South Africa. It's one of my favorite child and youth care kind of environments. And I hope that it was helpful for people to hear what I have to say. It's important to keep growing and thinking about what we're doing. So thank you all for the opportunity. And I hope that you go forward with this process and continue to grow. Thanks again.
Thank you, and thank you very much for sharing your time and your knowledge and expertise with us. We appreciate it very, very much, and hope to hear from you soon in this year still. And thank you to all the participants. We will now close this session, and hope that you will connect with us next month during Child and Youth Care Week. Thank you and goodbye.
Goodbye.